Good afternoon, ladies and gentlemen. The cases of asthma is on upsurge with 338 million cases worldwide. On 7th May, we celebrated World Asthma Day. On this occasion, we have Dr. Sonia Dalal, a senior pulmonologist, who would take us through the journey of conquering over asthma. Welcome, madam. We would like to ask you some questions so that people would know about asthma.
Thank you very much. Good afternoon, viewers. It's a privilege to be on this Facebook page live to help you to know more about asthma. So we have a question from Ms. Heer Thakur. What is asthma? Here, asthma is basically a disease of airways of the lung where there is inflammation. उसका मतलब ये होता है कि सांस की नली में सूजन आ जाती है और सूजन की वजह से सांस लेने में दिक्कत होती है। जब वो सांस लेते हैं तो उनको तकलीफ होती है और सूजन की वजह से जो मसल सांस की नली के आगे पीछे होते हैं वो स्पाज्म में चले जाते हैं। उसकी वजह से पेशेंट को खांसी होती है, सीटी जैसी आवाजें आती है और वो they become very restless. So asthma is a disease of a breathing tube which causes bronchospasm. Well, asthma is a very heterogeneous disease. When I say heterogeneous means there are so many causes. The first cause would be a genetic. Genetic means that if a parent, any of the parent has an asthma, the child has a probability to develop asthma. Allergy. Any patient who has an allergy manifests in 5 places: eyes, nose, throat, skin, and lungs. So allergy can manifest in the lung in form of an asthma. There is an upsurge in pollution in our country. So pollution can also be one of the cause for asthma. Occupation. Patient can develop an occupational asthma wherever they are working and there is a gaseous exposure or a pollutant exposure or an environmental exposure, patient can develop asthma. Patient can also develop asthma because of chronic infections. Obesity, overweight can also lead to a condition which is called chronic asthma.
Thank you, ma'am. The next question from the viewer is from Mr. Ujjwal Acharya. What is passive smoking?
Well, passive smoking is the person himself or herself are not smoking, but they are in constant touch with a person who's a chronic smoker. So, whatever symptoms or whatever disease a person who is an active smoker develops, has all the chances of a passive person who is in constant touch with a smoker has also the same chance to develop a disease.
Thank you, ma'am. The next question from Mr. Ramji Yadav is at what age does asthma start?
So there is no age basically for an asthma. Asthma can occur in an infancy. A child can be born with an asthma. It can also occur in a teenage or it can occur in the late age. So there is no basically a age bar for development of an asthma.
Thank you, ma'am.
Basically a long-standing cough, breathlessness, wheezing. These are the main causes of asthma, but it's basically more of a cough with wheezing. Wheezing, what I mean by wheezing is I would like to talk in a vernacular language. પેશન્ટ કે છાતી બહુ ભારે લાગે છે અને અંદરથી સીટી જેવો અવાજ આવે છે અને પુષ્કળ ખાંસી થાય છે અને ગળામાં કશું અટકેલું હોય એવું લાગે છે. જ્યાં સુધી એ ગળફો ના નિકળે ત્યાં સુધી અમને ચેન પડતું નથી. So these are the classical symptoms where a patient has got a breathing tube which goes into a constant spasm. So when it goes into a spasm, it's like they feel very constricted, heaviness in the chest, and they're not able to bring out the phlegm, and it is constantly wheezing. It is as if you're playing a flute, and that the area from where the mouth is there on the flute is is constricted, and that is how is the shape of the breathing tube.
Thank you.
Lung infection is a very broad term, basically, right? So you can have a community acquired infection, you can have a hospital acquired infection, but any patient who develops a lung infection would basically start with cough, will have an expectoration, which might be mucoid or mucopurulent. When I say mucopurulent, it has got a color like white color, thick, or a grayish color, or patient can also bring out blood, or a patient is breathless, and patient also has fever. So these are basically some, and chest pain. So these are the signs of lung infection. Having said that, lung infection can also be one of the most important trigger to develop an asthma. And patient chronic infections, a patient having a chronic lung infections also have a tendency to develop asthma.
Thank you, ma'am. The next question from the viewer is, can chronic long-standing cough be a sign of asthma?
Cough basically is a symptom, right? It's a symptom. So when a patient who has got a long standing cough, that patient needs to be investigated. So what is the reason of the cough? And one of the reason would be asthma. It can also be any allergy, it can be rhinitis, it can be sinusitis, it can be infection, it can be tuberculosis. But one of the reason for a chronic cough can be asthma.
Thank you, ma'am. The next question from the viewer is, what are the asthma triggers?
Asthma triggers are allergy, occupational exposure, environmental exposure, seasonal variation, and infection. So if you can identify a trigger, let's say if the patient is allergic, right? If you do a allergic testing, and if you can identify that the patient is allergic to a particular thing, if you avoid that, for example, the aero allergens, that means all those allergens which are inhaled, which can cause a trigger. If they are house dust mites, they are pollens, they are molds. If you can identify by an allergy test, we normally do a skin prick test in our hospital, from which we tell the patient that you are allergic to a house dust mite or a pollen or a mold or a dog dander or a cat dander. And if you try to avoid that, probably your attack can be prevented. Similarly, if the patient has got chronic infections, right? If we take care of the infection properly, if we give them good vaccines and avoid them developing a community acquired infection, if we know that the patient has got an occupational exposure, we would advise them to stay away from what exposures in their occupation is, and either change the job or change the place where they are working. If we know about the environmental exposure, if we can avoid that, so if they can, you can chase the triggers like that. So immunization is for the infections. So we have immunization for a community acquired streptococcal pneumonia, which is 70% causes community acquired pneumonia, where we call a pneumococcal vaccine. And we have a vaccine against viruses, which is influenza. And that influenza vaccine are to be given every year, since the strain of that virus changes. So we have a vaccine against viral infections and a streptococcal pneumonia.
Thank you, ma'am. The next question is asthma permanent disease?
Well, it all depends when you develop an asthma. So if the patient has got, and if the diagnosis is made in a very early stage, then yes, you can conquer and you can win over asthma, where the patient probably, if he takes care of the triggers, then asthma can be curable. Having said that, if it's an adult onset asthma, if the patient has got a very poor lung function, still we have good drugs which can control the disease. So there has to be a win-win situation from the doctor as well as from the patient, where you know how to control the disease. Once the disease is controlled, you can also aim for cure.
Thank you. The next question from the medication cause asthma?
Yes, there are certain classes of medications which causes asthma. The painkillers, which is called non-steroidal anti-inflammatory drugs. If the patient has got any pain and has a tendency to develop asthma, if they take those medications, they would definitely develop an attack of an asthma. Then there are certain cardiac medications which can cause asthma. The beta blockers. Beta blockers are the ones used for blood pressure control. They are also used in migraine sometimes, and they are used for cardiac patients. If they take that, that can and has a tendency to develop an asthma, it can trigger an attack of an asthma.
Pulmonary diseases are at high levels. How can we reduce it?
Well, we need to have a lot of awareness about this. So the thing is, why the tribal area? Because of the lack of a good medical facility in the tribal area, and the patient suffers for a long time before they reach to a real correct person who can diagnose their disease. And the tuberculosis is still increasing. There are a lot of things, allergies which is increasing, and there's no good medical awareness into the tribal area. So people like us, we should go to the tribal area, start doing good camps, awareness programs, diagnosing the disease at an early stage would probably help us in conquering all the disease, not only respiratory but all the disease per se.
Thank you. Nowadays, females are habitual smoking. What to advise them?
I would advise anyone, whether it is a male or a female, to abstain from smoking. Even a cigarette pack itself, it is giving a statutory warning that smoking is injurious to health. Why are we nailing our own legs? I mean, not only females, everyone should abstain from smoking.
Thank you, ma'am. The next question from what is the benefit of inhalation therapy?
Well, that is a $1 million question whoever has asked. Many a times we do get patients, especially pediatric patients, when we tell them that to the parents that your child has an asthma, and we will have to start on an inhaler. The first question is, why inhalation therapy, right? Why can't you get away with oral drugs or syrups? So we just then tell them the advantages of the inhalation therapy. The inhalation medication which is used for asthma, because asthma is an inflammatory disorder, we need to use an anti-inflammatory. So in such a case, the steroid is the best anti-inflammatory. So steroid which is used in inhalation form is in a very low dose, compared to which is given in the oral form, which is in a very high dose, and even the injectable form has a high dose. So when you use an inhalation therapy, there are two advantages. Number one, it acts directly at the site, and second thing is the drugs which are used are in a low dose, and the action is equivalent to the dosage which are given in the oral as well as in the injectable forms.
Thank you, ma'am. The next question, what is the role of dehumidifier?
The role of dehumidifier is only when a patient is allergic and the trigger is a mold. A trigger is humidity. When the patient has something like this, in such a case, that mold or a humid conditions can trigger the asthma attack. Especially all those patients who are living on the coastal side, those houses where they are very old houses and they don't have good sunlight coming there. Those are the people would probably will be benefited with a dehumidifier.
Thank you, ma'am. The next question from the what are the types of inhalation devices available?
There are a cocktail of inhalation devices available in the country. The meter dose inhalers, which are called a PMDIs. Then there is a dry powder inhalation therapy. Then you have a nebulization therapy. In the dry powder inhalation therapy, you have a single dose inhaler, you have a multi-dose inhaler. In pressurized meter dose inhaler, you have an attachment conduit which is called a spacer. So these are all various things available. You have to be selected, the device has to be selected on 1:1 basis, depending on the requirement and the compliance of the patient.
Thank you. The next question is due to environment differences, urbanization, heavy pollution, air problem, how can we save our lungs disease free?
So you need to have an awareness, and awareness. That is very important. And you need to know your local factors, your genetic factors, your triggers. We need to reduce pollution. We need to reduce the environmental exposure. We need to stay away from allergy, identify the allergy, and we have to keep a clean environment, stay away from all the pollution. And these are the things that they're very pivotal in treating all the diseases. Again, awareness about a long-standing cough, a breathlessness, go to the doctor immediately, get yourself investigated, start the treatment early. These are the most important factors that are to be kept in mind so that you can conquer over any disease, not only asthma, any disease, and abstain from smoking or tobacco in any form.
Thank you. The next question from what is the role of air purifier?
Honestly, there is no role. It is just a marketing gimmick by all the companies. Air purifiers don't work at all, and they are not the ones which will help in winning over asthma.
The next question how is asthma treated?
That's a very pivotal question, and it's a basically a very small. I cannot answer in just one small line. Asthma, according to the GINA is the global initiative of asthma. They have set up a guideline, and then you have a mild, moderate, and severe asthma. And depending on the signs and symptoms, and depending on their pulmonary function test, we decide what treatment is to be given to the patient. So, the treatment of asthma is first you have to investigate properly and prove that the patient has asthma, and then you start the patient on inhalation therapy. So to begin with, you have to start an inhaled corticosteroids, right? And then you also give a rescue medication which is in form of a salbutamol. As I said, that asthma is a disease of airways where there is an inflammation inside the airway, and outside the airway there are smooth muscles which go into contraction and spasm. So when you give anti-inflammatory in form of steroids, it takes care of inflammation. And when you give SOS or as and when required a salbutamol, that is a beta 2 agonist, that would take care of a bronchospasm, that the muscle which goes into spasm, it relieves that spasm. So to begin with, it is inhaled corticosteroid, and as and when required, beta 2 agonist. Then you can add a long-acting beta 2 agonist in an inhaler, either a meter dose inhaler or a dry powder inhaler, or you can add certain drugs if the patient is not controlled, like a montelukast or a derifylin derivatives.
Thank you. The next question from the viewer is will patient not become addicted to inhalers?
So when my patients and parents specifically, because when we get pediatric patients and then even the teenager who are probably, a teenager girl, when a mother will say that, madam, my daughter is to be married, and if they come to know that she's taking inhaler, that's a stigma in our country. And they also ask that, my child won't he become habitual? So the only question that I ask them in return is that if you have conjunctivitis, what do? You take a oral drug, or you put drops in the eyes. Similarly, if you have burns on your hand, do you apply a burnol, or you take an injection or an oral drug? So inhalation therapy is a type of a therapy which acts locally into the breathing tube. There is nothing like that you become addicted to it. There is no tobacco inside, nor there is any alcohol inside that the patient would become addicted to it. It's a type of a therapy, and if it is used judiciously, maybe we can conquer over the disease and get off the inhalation therapy.
Thank you. The next question from the viewer is what are the drugs used for asthma?
So, as I said previously, also the crux of the treatment for asthma is inhaled corticosteroids. So we use inhaled corticosteroids, then we use beta 2 agonist, right? So we have a short acting beta 2 agonist and we have a long acting beta 2 agonist. Long acting beta 2 agonists are salmeterol and formoterol, which can be added to the steroids so that you can have decrease in inflammation and constant opening of the breathing tube where they keep the muscles completely relaxed, and a short acting beta 2 agonists which are used as a rescue medication. So whenever there is a big bronchospasm or a bad bronchospasm, the short acting beta 2 agonist would act. Then you have leukotriene antagonist, which is montelukast. In such a patient, all those who have allergic rhinitis or an allergic asthma component, where only budesonide or and a long-acting beta-2 agonist are not acting, I mean not sufficient enough. Then you have anti-muscarinic drugs, where you use a tiotropium. So it all depends on the doctor and the patient's symptoms as well as exacerbation. How many times the patient needs to get admitted for the asthma attack, depending on which these are the type of the drugs that we prescribe to our patient. Oral steroids can also be prescribed, but it should be avoided. To be very honest, it should only be used when the patient is in exacerbation. I mean, these are the just a fair, bird's eye view of the name of the drugs that I'm giving, not confusing the viewers. To be very honest, let it, I mean, just leave it to your doctor. They would decide in a better way what are the drugs to be used for you in case of you have an asthma or your relative having an asthma. Of course, they are harmful. Steroids are harmful. It's like a double-edged sword. Right? You cannot do without a steroid. So, in case of an exacerbation, when the patient is very bad, the oxygen level is very low, patient is continuously wheezing, the patient is having a lot of breathlessness, and you know that the only anti-inflammatory which in asthma which works is steroids. In such a case, you have to use steroids either in an injectable form or an oral form. But once the patient is completely controlled, using an inhaled steroid, you are reducing the dose to such an extent from a microgram to from a gram to a microgram. In such a case, when steroid is not happening because it is acting locally. So side effects of high dose of steroids are osteoporosis, where the bones become very soft. The patient has a tendency to develop fracture. Patient develops diabetes, blood pressure, and steroid itself causes immunity to go down. So the tendency to develop infection is very high. So in such a case, it is always better to give an anti-inflammatory in a lower dose and in a local action. So I would repeat again and again, use steroids, use judiciously, but only in an inhalation form when your patient has asthma.
Thank you so much, ma'am. The next question is, what are the controllers and relievers?
I think the viewers have read and done a lot of homework to find out about asthma. I mean, the controllers and rescue medications are basically for the doctors. However, since they have asked, I would tell a rescue means whenever you have an attack, you need something which is going to rescue you, right? And a control is that you are doing something which is avoiding an attack. So controller medications are those medications which have to be taken on a regular basis so that you are avoiding an attack. So the controller medications are inhaled corticosteroids, inhaled long-acting beta-2 agonist, leukotriene antagonist, right? Montelukast. And what do I mean when I say a rescue? In spite of taking controller medication, there is an attack, right? And when there is an attack, you need to do something to conquer over that. So the rescue medications are a short-acting beta-2 agonist or short-acting anti-muscarinics. So they are salbutamol or they are ipratropium, which would probably take care of an attack and allow the controller medications to work properly.
Thank you so much, ma'am. The next question from the viewer is, can asthma affect profession?
If the asthma is not controlled, of course it would. I mean, if you have an attack, there would be definitely an absenteeism from the school. There would be absenteeism from the work, right? So, if the asthma is completely controlled, right, there's no way that it would affect the work. But if the asthma is not controlled, it would definitely affect the work.
Thank you so much, ma'am. The next question from the viewer is, what is the role of exercise in asthma?
There are two things. Patient can develop exercise induced asthma, right? But that's a completely a different terminology which I'm using. A patient becomes breathless, develops a bronchospasm, starts coughing immediately after exercise, which is called an exercise induced asthma. But in asthma, there is a role of an exercise also. So if your asthma is under control and you want to control it properly, you start doing good exercises, strengthening of the muscles, yoga, you do pranayam, and these are the things which are going to make your lungs strong and also help in, reducing the drugs or controlling the asthma and eventually getting the cure.
Thank you so much, ma'am. And next question is, what is severe asthma?
Severe asthma is a condition where all the drugs which I have mentioned previously, it in spite of taking that and then taking oral steroids, they are having recurrent asthma attacks and getting admissions. So such a case, patient probably is always symptomatic and getting admitted for exacerbation. Severe asthma is a very pathetic condition. The patient is completely steroid dependent. All the other factors have been changed, has been cleared. They are on the highest dose of inhaled corticosteroids, highest dose of beta 2 agonist. Still, their asthma is not controlled. Such a patients are very bad and are called severe asthmatics.
Thank you so much, ma'am. So we are just waiting. So if, especially for viewers, if you want to share any of your patient case with our, you can share with the viewers, ma'am, any patient case.
All right, so I would take around 5 to 10 minutes for the approach. How do I do in my practice? So when my patient comes to me and with a cough, wheezing, the first thing is what I do is I try to prove whether my patient has got an asthma or not. So how do I prove it? I do a pulmonary function test. I get certain blood tests in the form of absolute eosinophil count or serum IgE, and then on the basis of this I diagnose the patient as asthma. If the patient does not have an asthma, the patient might have some other conditions which are mimicking asthma. We treat the other condition. Then after that we look start them on inhalation therapy. We sit with them, we counsel them, we always tell them that look, inhalation therapy is the answer. You need to take inhalation therapy properly. I have a doctor friend of mine who is with me, who always is after their head teaching them the real technique of the inhalation therapy. And then we always ensure at every visit that they are taking their inhaler properly. So the next step is we ensure the treatment is being done properly. We also then address the other conditions which can make their asthma worse. So, like we treat allergic rhinitis, we treat sinusitis, we take care of obesity hypoventilation syndrome or an obstructive sleep apnea if they have. And then we also try to find out if they have any other disease along with asthma. Then we add other drug if the patient's asthma is not controlled, and if the patient's asthma is completely controlled, if all the drugs are used and asthma is still not controlled, we then think of using higher drugs which are called biologicals. So I would like to now share one case of mine. The lady who's a teacher who came to us with a very bad asthma attack, and she had cough, breathlessness, wheezing. Her absolute eosinophil count was thousands. To viewers, I would like to say that eosinophil counts are always less than 400, but it was more than 1000, and her IgE level was around 140. Her pulmonary function test shows severe obstruction. Why severe obstruction? Means breathing tube is into complete spasm. And after the drugs also, there was not much of a recovery. She was on a very high dose of steroids. She was on a high dose of inhaled corticosteroids. She was on high dose of long acting beta 2 agonist, and every day she used a rescue medication also. So in such a case we ultimately had to shift over from all these drugs. We had to continue that but switch over to a biological which is called omalizumab. Well, so any patient who is on oral steroids and inhalation steroids and not getting control, please contact us. Please come to Sterling. We will help you how to conquer a severe asthma or how to conquer an uncontrolled or a poorly controlled asthma.
Thank you so much, ma'am. It was a really interesting case. We have two more questions. The first is, what is antibiotic role in asthma?
So there is no role, to be very honest, if the patient has got an exacerbation of an asthma. Exacerbation of an asthma, as I said, it is an inflammatory exacerbation. So always when there is an exacerbation, a patient has no infection. When the WBC count shows that it is normal, don't prescribe antibiotic. It is only steroid which works. But if the patient has got an infective exacerbation, so if the WBC counts are more than 10,000, 11,000 or 12,000, then there is a role. But then use a very simple antibiotic, which is a community acquired infection. So you can use a macrolide or an amoxicillin or a and a clavulanic acid only for 5 days, and it would suffice.
Thank you so much, ma'am. The next question is, what is COPD?
It is a chronic obstructive pulmonary disease. Patients do behave like asthma, but it is not asthma. And it occurs at an age which is after 40 years of age, and the causes for COPD are completely different. Most of the patients who develop COPD are chronic smokers.
Thank you, ma'am. The next question is, what is PFT?
PFT is a pulmonary function test, which is very vital in the diagnosis of asthma. What we do is we subject the patient to do a pulmonary function test to look at the physiology of the breathing tube, and when the the bronchospasm is there, their FEV1, or what we say, we have a obstructive pattern into the PFT, and then we give them certain medications. After that, this medication, the reversibility shows that it's a very good reversibility, which says that patient has got asthma and the drugs would act on the breathing tubes.
Thank you so much, ma'am. The next question is, AC નો વપરાશ નુકસાન કરી શકે?
એસી નો વપરાશ કેવી રીતે કરો છો એના પર બધો આધાર રાખે છે. સૌથી પહેલા તો એસી ને બરાબર ક્લીન કરવું જરૂરી છે. શિયાળામાંથી જ્યારે ઉનાળામાં જાઓ ત્યારે તમારે તમારા દરેક એસી નું ક્લીનઅપ બરાબર કરાવવું જોઈએ. જો સ્પ્લિટ એસી હોય તો એની સર્વિસિંગ બરાબર કરાવો. વિન્ડો એસી હોય તો એની જે નેટ હોય છે એને ધોઈ અને ક્લીન કરો, કારણ કે એ જે નેટ હોય છે એની અંદર ફૂગ લાગી શકે છે, અને એ જો શ્વાસોશ્વાસમાં જાય તો એ દમ કરી શકે છે. બીજું કે તમે પુષ્કળ ગરમીમાં હો કે જ્યારે તમે 44 ડિગ્રીમાં બેઠા હો અને એસી ને 20 ડિગ્રી રાખ્યું હોય અને સડનલી એ 20 ડિગ્રીમાંથી 44 ડિગ્રીમાં જાઓ, there is a sudden temperature difference, પેશન્ટને અસ્થમાના સિમ્પટમ્સ થઈ શકે. તો તે વખતે તમારે એસી નું ટેમ્પરેચર ધીરે ધીરે વધારી અને 27, 28 કે 29 કરવું પડે. 10-15 મિનિટ બેસવાનું અને પછી ધીરે રહીને તમારે એક્લિમેટાઇઝેશન કર્યા પછી બહાર નીકળવું જોઈએ.
Thank you so much, ma'am. The next question is, how the name came as asthma?
But that's a Latin word, right? It's a Latin word. And why are people interested in knowing how the name came? The best important thing is that we have to conquer over the disease. What is in a name, right? So there is nothing in the name. It is very important that we need to conquer over the disease. Asthma is a Latin terminology given to the disease of the breathing tubes.
Thank you so much, ma'am. The next question is, how to avoid salmonella and substitute of it?
I didn't get the question.
Salbutamol.
Okay, so that is one of the most common side effect of salbutamol. So when you take salbutamol, it's a beta 2 agonist. It acts on the muscles. So then there are lot of tremors. You don't have to worry about it. Those are very transient, and you don't have to actually worry about that. You can, if the patient has got a lot of tremors because of salbutamol, you can add ipratropium, which is anti-muscarinic, which also acts as a good bronchodilator and get away from salbutamol.
Thank you so much, ma'am. The next question is, which laboratory investigation to help in check out attack of asthma?
So there are no laboratory investigations per se which will give you a diagnosis of asthma. But the laboratory investigations would tell you what type of asthma a patient has or what are the triggers. So if I say that the patient has got allergic asthma, I mean that the patient's IgE level, that is immunoglobulin E levels, are very high. If I say that the patient has got eosinophils which is very high, that is absolute eosinophil counts which are very high, it is called eosinophilic asthma. Right? If the patient has got WBC count which is very high, it's the infection which is triggering the asthma. But the diagnosis of the asthma is history, blood reports to substantiate or to identify the triggers, the allergy test, especially when you are suspecting allergy, A skin prick allergy test is ideal over the blood investigations. And the pulmonary function test, which is called a spirometry, which shows obstruction and a post bronchodilator reversibility after giving a salbutamol. So these are the, the set of investigations which will help you in proving that the patient has asthma. The blood report per se will not give you a diagnosis of asthma.
Thank you so much, ma'am. The next question is that anyone with asthma
થાય જ ને, કેમ ના થાય? આઈ મીન કૂતરાના વાળ હોય, બિલાડીના વાળ હોય, ગાય હોય, એના વાળ હોય, પૂંછડાના વાળ હોય, they all are antigenic, right? And those antigenic are allergens. જો એ શ્વાસોશ્વાસમાં જાય અને એ જ ટ્રિગર હોય અને એના કારણે જ એલર્જી થતી હોય તો તમારા શરીરમાં આઈજીઈ લેવલ વધે અને એ આઈજીઈ લેવલ જ્યારે વધે ત્યારે એ અસ્થમાને ટ્રિગર કરે.
Thank you, ma'am. The next question is it the genetic disease?
I told you one of the causes genes, right? So all the asthmatics are not genetic disease driven, but some of the asthmatics are genetic. So if anyone in the family has got asthma, the child has a probability or a chance to develop asthma. Mother ne hoy to son ne થાય કે daughter ne થાય, father ne hoy to son ne થાય કે daughter ne થાય, or else mother father ના હોય પણ grandparents ને હોય તો પણ થતું હોય છે. So one of the cause is genetic.
Thank you, ma'am. The next question is home care to emergency asthma case.
Not in emergency, all asthma cases. Home care is very important. So whenever any patient who comes to me, I tell them stay away from 5 things: ધૂળ, ધુમાડો, આર્ટિફિશિયલ કલર, ખાવાનામાં. એટલે ડોન્ટ ટેક કોઈ બી જાતના શરબત, કોઈ પણ પ્રકારનું ચાઇનીઝ ફૂડ, કોઈ પણ પ્રકારનું બહારનું ફૂડ જેમાં આર્ટિફિશિયલ કલર ગયો હોય, કોઈ પણ પ્રકારની મીઠાઈઓ જેમાં આર્ટિફિશિયલ કલર ગયો હોય, ઠંડા પીણા જેમ કે પેપ્સી, કોક, થમ્સ અપ, મિરેન્ડા should avoid, શરબતો, રસના, આ બધું બંધ, અવોઇડ ધેટ. એન્ડ કોઈ પણ પ્રકારની સુગંધ કે દુર્ગંધ, મચ્છર મારવાની દવા, સ્પ્રે, ઓલ આઉટ, perfumes, deodorants, you have to stay away from this. So and in the house you have to keep it very clean. Asthmatic patient ની આગળ ઝાપટ ઝૂપટ કરવાનું નહીં, કચરો વાળવાનો નહીં, બ્લેન્કેટનો યુઝ કરવાનો નહીં, ગાદલા ગોદડા હોય તે દર અઠવાડિયે તડકે જવા જોઈએ. ઓશિકાના કવર, ટોવેલ, ચાદરો દર 8 દિવસે પલાળી અને તડકામાં સૂકવી દેવાની. સવારે 5 થી 7 ને રાતના 5 થી 7 જો ગાર્ડનની આગળ પાછળ રહેતા હોય તો દરવાજા બંધ રાખવાના, કારણ that's the pollen time, right? So these are the things. અને હવા ઉજાસ આવવો જોઈએ કે ઘરમાં ભેજ ના રહે. These are the things where you can take care broadly to prevent asthma.
Thank you so much, ma'am. The next question is can you guide about the side effects of asthma medicines?
Okay, so as I said, steroid is the mainstay in the treatment. ઓરલ સ્ટીરોઇડ થી બધી બહુ સાઇડ ઇફેક્ટ્સ થતી હોય છે, જેમ કે હાડકા પોપલા થઈ જવા, દેટ ઇઝ ઓસ્ટિયોપોરોસિસ, જલ્દી પેથોલોજીકલ ફ્રેક્ચર્સ થઈ જાય, એનાથી ડાયાબિટીસ થાય, એનાથી વજન વધે, એનાથી બ્લડ પ્રેશર થઈ શકે, શરીરમાં ફૂલાવો આવી જાય, પાણી ભરાઈ જાય. સો ધીઝ આર વન ઓફ ધ સાઇડ ઇફેક્ટ્સ. સાલ્બ્યુટામોલની સાઇડ ઇફેક્ટ્સ જે હમણાં એક દર્શકે પૂછી હતી કે ટ્રેમર્સ આવે, એટલે એનાથી ટ્રેમર્સ પુષ્કળ આવે. પછી મોન્ટેલુકાસની બહુ ખાસ સાઇડ ઇફેક્ટ છે નહીં. ડેરિફાઇલિનથી કાર્ડિયાક કોમ્પ્લિકેશન્સ થતા હોય છે, ન્યુરોલોજીકલ એટલે મગજના કોમ્પ્લિકેશન થતા હોય છે, એસિડિટી થતી હોય છે, બળતરા થતી હોય છે. ધીઝ આર ધ broad broad side effects of the asthma medications.
Thank you, ma'am. The next question is allergy cover કરાવો.
એલર્જી એઝ આઈ સેડ કે 5 જગ્યાથી આપણને ખબર પડે. પુષ્કળ આંખમાંથી પાણી આવે, નાકમાંથી પાણી આવે, છીંકો પુષ્કળ આવે, ખાંસી થયા કરે. અસ્થમાના સિમ્પટમ્સ છે કે ખાંસી આવી, શ્વાસ ચડવો, સસણી બોલવી, છાતી ભારે થઈ જવી, કફ ગળામાં લાગ્યા કરવું, જ્યાં સુધી એવું લાગે કે કફ નીકળશે નહીં તો ચેન નહીં પડે, રાઈટ? ચામડી પર ચાઠા પડી જાય, ખંજવાળાયા કરે. So these are the broad symptoms of an allergy. And they would, people who are chronically allergic are very, they can pick up કે આજે મેં આ ખાધું તો કાલ મને તરત જ મને ખંજવાળ ચાલુ થઈ કે તરત જ મને ખાંસી આવી. So those are the things where you can find out that these are the allergic symptoms or allergic problems.
Thank you, ma'am. The next question is, ઉનાળામાં અસ્થમા દર્દીએ કઈ બાબતે સાવચેત રહેવું?
ઉનાળામાં એઝ આઈ સેડ ઇફ યુ એર કન્ડિશનરનું ટેમ્પરેચર જો બહુ જ ડિફરન્સ રાખ્યું હોય તો દેન દેર આર ચાન્સીસ કે પેશન્ટ વુડ પ્રોબેબલી ડેવલપ એસ્થમા બીકોઝ ઓફ અ ચેન્જ ઓફ ટેમ્પરેચર. બહુ જ વધારે પડતા ઠંડા પીણા પીધા, બહારના આઈસ્ક્રીમો ખાધા, ગળું પકડાઈ ગયું, શરદી થઈ, પેશન્ટ કેન ડેવલપ એન ટ્રિગર ઓફ એન એસ્થમા. પરફ્યુમ deodorants because પરસેવો બહુ થાય, you can use that. So these are the things where you have to take care.
Thank you. Next question is, suffocation or synesthesia can also symptoms of asthma.
Of course it can be because there is a very bad bronchospasm. શ્વાસની નળી એટલી બધી બંધ થઈ ગઈ હોય કે ગુંગળામણ is the first thing. પેશન્ટ એવું લાગે મારાથી શ્વાસ જ નથી લેવાતો. I become claustrophobic. I have a problem. So I mean it's one of the sign. It's all how you describe your symptom. ઘણા લોકો એવું કે મેડમ છાતી બહુ જ ભારે થઈ જાય છે, છાતીમાં દુખાવો થઈ જાય છે. So it's all a perceivance of the symptoms, how you describe your symptom. ગુંગળામણ થવી, ગભરામણ થવી, it's also one of the type of an explanation of a symptom by a patient.
Thank you, ma'am. The next question from the viewer is, how long we can take a medicine for asthma? Is there any permanent solution?
So, as I said, if you diagnose asthma in a mild or a moderate case, there are all the chances that you can get off the medication. In case of a severe asthma, you have to continue for a long time, or it might probably also be lifelong. But then, sometimes when the patient is without attack or without exacerbation, the drugs can be reduced and come to an optimal dose where their symptoms and exacerbations are prevented. So I mean, it's not that each and every patient is going to take a lifelong treatment for asthma. You can also first conquer and control and then aim for the cure.
Thank you, ma'am. The next question is the asthma disease multi-level organ disease or
Well, it is not basically a multi-organ disease. It's only a lung disease, but asthma can worsen if you have some other organ disease. So asthma is basically connected to it, but asthma itself does not have a systemic manifestation.
not? The next question is, which season is mainly called as the asthma season and why is it?
So you have monsoon and you have winter or a change of weather. Most important thing is when there is a change of the season or change of the weather, the transition from summer to monsoon or a monsoon to winter or a winter to summer is the worst time for an asthmatic patient if the patient is not controlled on the medication. If the patient is completely controlled on the medication, I don't say season should also be a bar.
Thank you so much, ma'am. The next question is asthma a viral disease?
It is not, as I said again and again, it's an inflammatory disorder. Viral infection can trigger an asthma, but it is not a viral disease.
Thank you, ma'am. Next question is, if someone medicine that is steroid, can they come out from them and how?
Yes, they can, and for that, if they are completely oral or a injectable steroid dependent, please contact us. We will help you to get out of steroids. I mean, on this web Facebook Live forum, how to come out of steroids is beyond the context of the talk. So, if they are steroid dependent, they have to contact us because then they fall into a severe asthma category for which they need help of doctors like us.
Thank you, ma'am. The next question is, steam inhaler can help in asthma attack.
No, not at all. Unless a patient has got a comorbid allergic rhinitis or a sinusitis with asthma, then stimulation can help where it can help in clearing the nasal secretions.
Thank you so much, ma'am. It was really informative session. Would you like to share closing for the session and a few tips for our viewers?
So thank you very much, viewers. It was indeed a pleasure answering all the questions. We are still at Sterling Hospital. If there are any queries, please put your questions on the Facebook page of Sterling, and I'll be more than happy to answer all the questions regarding any respiratory disorder. And yes, if you have any allergy, if you have any long-standing cough, or if you have a family history of an asthma, I would still urge that you go and get yourself investigated thoroughly. You never know, you might have asthma or anyone in your family might have, and we would be of a great help to combat a mild disease and win over it rather than making it become very severe. Thank you very much. Appreciate your listening.